Hi, this is Dr. Sutton with MDI Prep, and welcome to another sample of the MDI Prep INBDE class. Sit back and enjoy.
For the folks who haven't had pediatric dentistry yet, don't worry. We spend 2 more whole evenings together just talking about these baby teeth. But a little general gist is that in our primary dentition, we have central incisors, lateral incisors, canines, first molars, and second molars. We are not having any premolars in the primary dentition. Some things, again, we'll talk on in the primary lecture or the pediatric lecture that some of you might already had is the different appearance of the primary dentition. So our primary dentition is appearing, the teeth appear whiter, a little bit more bulbous, and we're going to see very shortly here that there's a difference in mesiodistal width of these teeth depending on if we're in the anterior or the posterior when we're comparing them to our adult dentition. And they serve a very important role in preparing the oral cavity for our adult teeth to erupt into. So again, we have our first molar typically erupt around 6 months of age. And then we're at around 6 years of age, we can see our first permanent tooth come into the mouth. So this is the general timeline of our primary dentition. A key takeaway from this slide is that in our primary dentition, they actually have a little bit of a different presentation in regards to the ideal overjet and overbite. In a patient, again, we talked about yesterday, an ideal overbite would be anywhere from 10% to 20%. And an ideal overjet is anywhere from 2 to 3 millimeters. That's in our permanent dentition. In our primary dentition, we're actually looking for a child to have minimal overbite, or they're going to be biting end to end. And we're going to see that here shortly. And minimal overjet. So again, it's a very edge-to-edge occlusion. And this is ideal for our primary dentition. Beyond that, it's also ideal in our primary dentition to have a decent amount of spacing. Again, this spacing is going to serve for the to create proper space for our larger permanent dentition to erupt into. And this is specifically in our anterior region. So distal of our canine to distal of our canine, these are called our primate, or not our primate spaces, our interdental spaces. I apologize. And again, the interdental spaces are the spaces seen in the anterior portion of our primary dentition that's going to make room for our permanent anterior dentition, which is of a larger mesiodistal width, to erupt into. If we look here on the right-hand side, this is negative. So I don't want this to be like a good thing. Let's start, it doesn't mean good. In a bomb type 2 patient, they're actually crowded in their primary dentition. So you can imagine that in the permanent dentition, even bigger teeth try to erupt. In this anterior segment right here, there's going to be some crowding that results as a, or crowding that exhibits as a result. So let's take a little bit of a better picture here. Can someone let me know between the patient here that's A or the patient that's B, which one is it presenting with a more ideal occlusion in the primary dentition? And please just don't worry about the caries that are present.
Patient B.
B.
Beautiful. Yes. In patient B, we see a minimal overbite, minimal overjet, and this beautiful interdental spacing. Great job. As you can imagine, with this deep overbite and a little bit of residual crowding here, we're not seeing any spaces. This patient's going to have a little bit more difficulty when their permanent dentition erupts. Great job. So again, the second that we have a permanent tooth erupt into the mouth, we are moving right on forward into our mixed dentition. Mixed dentition, again, is just a mixed presentation with our baby teeth and our adult teeth. The mixed dentition is probably the little bit trickiest part in this conversation that we're going to have this evening, only because this is when we're seeing most of our spaces that you guys have probably at least heard buzzwords for. And we're going to talk about which of these spaces are. We've already talked about our interdental, which is great. We're also going to be talking about primate spaces and leeway spaces as well. And this time period is also going to be responsible for what kind of molar occlusion we develop in our permanent dentition. So are we class 1, class 2, or class 3? And that's all going to be based off of our primary dentition molar relationship. And that's what this is. I'm going to kind of talk about this whole graphic as a whole, but the two key takeaways are going to be these two things I put in text here separately. So again, pay attention as I do this talk, but if you forget as you watch this recording, these are our two key takeaways. So we've already discussed our classification. So our class 1s, our class 2s, and our class 3s. And we're seeing that here in this column. These are our yellow teeth or our permanent molars, permanent first molars. For those folks who have had the primary dentition lecture, you know that we actually classify our primary dentition with a different classification system. This is going to be our step classification. So just as I review for some people, and this might be new for others, so I'm going to go over it with pretty good detail, just so that everybody's on the same playing ground here. In our primary dentition, I only want us to look at this first column of white teeth here first. These are primary dentition, and the step classification is based off of our primary second molars. So a little bit different than our permanent dentition, because our permanent uses our first permanent molars. So if we're looking at our primary second molars here on this column, what I do to determine the step classification is I draw straight lines on what's deemed our flush terminal plane, or a terminal plane, not flush necessarily, but a terminal plane. And that's the most distal surface of these primary second molars. Once I draw that step, I actually connect those two lines together like so. And then I imagine I'm walking down the stairs. So if I'm walking down the stairs this way, I'm walking in a distal direction. This is again flush. And if I'm walking down the stairs this way, this is going to be in a mesial direction. So that's how we identify our primary dentition, either distal, flush, or mesial step. If for some reason boards tries to trick you and a patient is presenting with both their primary second molars and their permanent first molars, because maybe we haven't exfoliated these yet and these guys have come in, I want you to make the classification based off of our classification system we talked about yesterday. You would at that point, the classification system trumps our step classification system. So again, you would do an angle classification of 1, 2, or 3, and you would forego the distal step, the flush terminal plane, or the mesial step. Anybody have any questions about identifying what the primary malocclusion is and labeling those before we talk about what the primary malocclusions lead to in our permanent dentition? All right, seeing that there are none at this moment, we talked last evening about the cephalocaudal growth gradient. And in that idea of things that are closer to the brain grow earlier on and things that are further from the brain grow later on, which jaw is most responsible for the latest growth? What grows the later on? The maxilla or the mandible?
Mandible.
Awesome. So I really want you guys to keep that in mind as we talk about what these guys on the left-hand side develop into. So bear with me here as I do some subpar drawings. So we're first going to look here at our distal step. In our distal step, again, the terminal plane is acting as an eruptive pathway, almost like a plane on a runway goes. So as a runway goes, we're going to have a permanent tooth erupt right here, and a permanent tooth come on its runway, and it's going to erupt right here. And we're actually going to get something that looks very similar to this class 2 malocclusion. All right, so what I want you to imagine here is if these molars erupted into this pattern, and I want you to take your right hand and hold it out and spread your fingers, and I want you to take your left hand and hold it out and spread your fingers out really wide, and I want you to take them both, and I want you to clasp them together with your fingers interdigitating. That's kind of what's happening here with this classification in these molar relationships. So this cusp of our mandibular molar is sitting perfectly in this groove here. So although we don't really enjoy that this is a class 2 malocclusion, the cusps are interdigitating similar to the way that our fingers are clasping. So this interdigitation is going to resist the forward growth of the mandible that may cause this molar to slip forward into an cusp-to-cusp relationship. Because it's really interdigitated, it's resisting that force. The cusp is going to have a lot of force to have to move forward into this cusp-to-cusp relationship as that mandible grows forward. So for that reason, a child with a distal step in our primary dentition will likely develop into a class 2 in our permanent dentition. Again, that's because as they erupt onto this terminal plane that we're seeing here, they erupt in a very interdigitated nature that's going to resist the forward growth of the mandible. So that's our first key takeaway. We're then going to go to our next key takeaway, and then we'll leave it at that just because that's the only things they like to test on in regards to these things. And I don't want to confuse you guys too much. So the next key takeaway is going to focus on this second relationship here. And this is our flush terminal plane. Again, flush and flush. So you can imagine with our new plane runways, as these permanent first molars erupt, we're going to have one right here and we're going to have one right here. And if they're going to look very similar to what we're seeing here in the middle or in a cusp to cusp relationship. Now I want you to take your right hand and put it into a fist and your left hand and put it into a fist. And I want you to give yourself like a knuckles, like you're going to do a pound it or a rock to somebody. And now it's a lot less interdigitated than as if your fingers were interlocking with each other. And that's our cusp to cusp relationship. So because nothing's really resisting that late forward growth of the mandible, more often than not, a flush terminal plane is going to erupt end to end, but then it's going to have that early mesial shift into a class 1 occlusion. So this is going to slip forward because nothing's resisting that late or that forward growth of the mandible, and we're going to actually end up here in a class 1 relationship. So again, the two key takeaways is that a distal step in the primary dentition will likely develop into a class 2 relationship, whereas a flush terminal plane, although it erupts end to end, it will have an early mesial shift into that class 1 relationship. Okay, I know that was a lot of words in only one slide. So does anybody have any questions in regards to these two key takeaways? I don't want you to get really hung up on the rest of this slide because those are the things they like to test the most. But the same kind of principle applies for the mesial step relationship that we're seeing at the bottom here. Okay. Well, then if there's no questions, you guys should be able to answer this bad boy pretty easily. As always, give everybody a few seconds to think about it on their own, and I'll have everybody call out the answer here in a second. So go ahead and read this over. And what do you guys are thinking for the answer for this one?
Class 2B.
B.
Good job. Very good job, guys. Yes, this is the class 2. Again, the distal step is going to erupt into a class 2 adult pattern. And because of that interdigitation of the cuspal relationship, it's going to resist that mandibular forward growth. And it's going to likely stay in a class 2. Good job. A few more technicalities in our mixed dentition before we dive into the fun stuff.